Hey everybody, it's Paul Barrett from the Modern Medicare Agency, and today I want to talk to you about Medicare Advantage Plans, particularly HMO style plans. Right here in New York, HMO plans have changed drastically since I've gotten into this business. Way back in 2007, HMO was like a dirty word to a lot of people. They just hated them. Why? Because you always had to get referrals. You had a primary care doctor that was elected as your, what they like to call, gatekeeper. That gatekeeper, his job was to make sure that you weren't over visiting any specialist and you weren't spending too much of the insurance carrier's money. Now, fast forwarding to 2023, I can tell you this, plans have changed drastically. So the two main problems that you have with HMOs, the first one, not much we can do about it. They are still going to have a closed network. HMO stands for Health Maintenance Organization, and basically it's a fancy term for a provider network that's closed. Anybody on the list you can go to, and in most cases you don't need referrals anymore, which is fantastic. But if you go out of network, it has to be urgently needed services or an emergency. So that's one of the big takebacks on the HMO. However, I can tell you this, as the years have gone by, we have some really wonderful HMOs right here in New York. Their networks are very large. Some of them are larger than PPOs. And that's a big deal because PPOs may allow you to go out of network, but 9 times out of 10, they're charging you extra money for going out of network. And if you have to go out of network a lot, well, guess what? You're going to pay a lot more. Most PPOs are going to have higher cost sharing to begin with, right? So their copays are typically higher. They may have a deductible for out-of-network services, all kinds of different things. So HMOs really aren't that bad anymore. They're actually nice, solid plans for someone that's looking for a low-cost option that maybe gives them some dental, some vision, some hearing, as well as maybe some over-the-counter benefits. They tend to be really solid benefit packages, and as I said, the network's not so bad anymore. You can find some HMOs that are double the size of PPOs in the area, and if you have all the doctors and hospitals that you want before you get started, then really it's not that big a deal, especially if you don't have to get a referral anymore. So I hope that clears up a little bit about Medicare Advantage HMO plans. If you have any questions at all about Medicare Advantage plans or HMO plans in particular, we'd love to hear from you. You can reach us directly at the office at 631-358-5793. All right, thanks for stopping by the site, and I hope you enjoy the rest of the